Off.
Off.
Just another day around here. I haven't picked up the camera all day. I did get up and pull myself together this morning. I have a baby trying to eat. Because I had to film a bunch of content, which is getting more and more difficult to do.
Yeah. Why you bring up the camera?
Yeah. Oh no, I'm saying like, it's harder to film anything these days.
Right.
How was your day?
My day was good. So as soon as I get home, get right to work. Actually, Kevin's back today. If you were here tomorrow, or if you were here yesterday, if you were here tomorrow, you saw Kevin, or yesterday. Kevin was doing the subway tile. Now he's finishing what I didn't want to do, which was the very last of this brick, not brick, stone down here. That's the worst part. So much cutting and grinding for these tiny little pieces. So what I'm doing right now, which I'll have done tonight, is putting the poles on the cabinet doors here, and then I'm going to so they all have, the doors all have these little screws that you can adjust to like go up and down, side to side. So I'll also try to adjust them so that they look the best they possibly can. And then I don't know if I'll get to it tonight, but a trim piece goes in between there. So that's my project for today. But yeah, it's funny that Rachel, they used to call her Peachel, asked about work because it was one of those random days that I had like 2 patients in a row with kind of a rare finding, which would be fluid inside their retina. One of them was a diabetic, but one of them just didn't have any comorbidities, like nothing else going on. So it was like a super random case. And so sending them to a retina specialist and they'll get treated. Usually, like with wet age-related macular degeneration, they'll do what's called an anti-VEGF injection into the eye. So if you've ever had that done, comment below, how did that feel? Most patients say it was like the worst experience of their life. Some patients were like, oh, it was just a little bit of pressure, not that big of a deal. It's like an injection into the eye. I'd say that's probably a big deal. All right, here we go. Got the poles in.
It makes such a big difference.
Oh yeah, it does make a huge difference. Well, it just ties everything together.
Took the words right out of my mouth.
Exactly. All right, there's a baby crying. I gotta go grab her.
Too much, okay.
So I think that was pretty smart. So, hey, what'd mommy have you do before we started dinner? Remember what she did? She had you close your eyes.
Take a bite of chicken.
Yes, because not exactly an attractive entree.
No.
Whatsoever,
I
especially
knew it was going to be a total bust if they looked at it and I served it to them. They've never had like chicken salad before.
Right.
I knew it was just going to be immediately no.
Immediately no.
So yeah, I had them all close their eyes and then I served them a bite of the chicken salad and they all loved it.
And now, look at them. Look at them go.
Yes, she did. She ate all of hers.
Yeah, she's doing great. Do you guys like putting it in the lettuce leaf to eat it? You like? Yeah. They actually really like salad, which is pretty cool, dude.
It's cool, dude. We're sitting here debating. So there's a small section under here where the tile doesn't quite reach the microwave. And
so like I hung the cabinets before we did the back splash. And so I wanted to make sure that we could fit 4 subway tiles. And I think I did pretty good.
You nailed it.
Like where I hung the cabinets.
yeah.
But I mean there is a 1/4 inch gap.
So it's like really negotiable, not non-negotiable.
So
Not non-negotiable.
let me see the camera.
What? Negligible.
Yeah.
Negligible.
So let me see the camera. So a normal heighted so I still need to put trim there and right there. So
It's this that
yeah, a normal heighted person cannot see that. However, if you're 5 foot like Rachel,
that's my view.
you can see it.
Yeah. So we're sitting here talking about whether or not it needs a piece of trim, and Brad's like, you literally don't see it unless you bend down and look under the cabinets like that. And I'm just like, that's not true. I'm standing at my full height and I can see underneath the cabinets. I don't think it would be a big deal to put a piece of trim on. What about right here? What about this point?
Right.
Can you see that where there's a gap?
Yeah.
It just looks kind of unfinished.
Yeah.
But if we had a shelf,
I mean, we're gonna grout.
if we had
we
a
could put the shelf right there. Great job, Lyndle.
the other thing that's kind of
Play club.
on our agenda is the encasement for the refrigerator, but we have to like sand it down, and
I'll do that
Strip
at the same
it.
time that I do the front of the island.
I'm curious to see how that goes.
Right.
Dad life.
I mean, we always could do white.
Yeah, we could.
We could always match.
Yeah, if it doesn't strip and sand easily, then we could just paint it. But this one, I feel like has to be
Yeah.
the wood.
We could just hire Mike to do it,
We could,
and he could just take him with him to do it at home.
totally. That's true.
Unless he wants to get out of the house.
Did you see this picture that Bear drew?
Yes.
There's one anatomical appendage in particular that I'm not sure what it is.
I believe that's a tie, honey. That's a tie. Is it a chin?
Our nanny said keep their drawings, like starting when they start drawing people, keep them and watch the progression of like how they draw legs, and then eventually they'll have like a torso, and I'm excited to see that. But his hair looks just like Eloise's hair.
Eloise's hair.
Yeah. And it's actually kind of flat right now. Actually, it looks kind of like Kate Gosling's hair, because it's spiky in the back and it's like
Does she
forward.
still look like that?
I don't think so.
This is
I think her
going
hair's
down
long.
big time.
I know.
Awesome.
But I feel like her heart is staying. Did you see that Colleen pointed out that her hemangiomas on her face are in the exact position of, I'll insert the emoji right here, the like heart on the smiley face, the 3 hearts around the smiley faces emoji.
I did not see it.
They're in like the exact locations. She is the living emoji.
Well, now I need to see that.
Yeah, so funny. Speaking of baths, we have given them both their first bath,
so that
and
one?
Yep, that's the one.
That's funny.
We've given them their first baths, and it was a wonderful experience, and they love it.
She needs one more.
So maybe we should insert that footage here. She's the one on her head.
That's true.
That's the one on the head of the emoji.
But, okay, yeah, that's pretty lined up.
I know.
That's incredible.
And one of hers is even a heart.
Weird.
I know.
What is this, the Twilight Zone?
So Buck just picked up the older kids to take them to the pool. And I'm here with the babies, and Laurie's coming over, and I'm not sure about my mom, but I don't know, shortly after Brad left for work this morning. So Carrie's off today, our nanny's off, and Brad went to work. And then shortly after he went to work, Buck texted me. That's my mom's twin, if you're new. It's my aunt. She texted me and was like, hey, I'm gonna come pick up the big kids and take them to the pool. And then a little bit after that, Laurie was like, my other aunt, my mom's other sister, she's like, hey, I'm gonna come over there and I can either help you or go to the pool and help with them, or if you and I want to take the babies to the pool, whatever you want to do. So I texted Brad and I'm like, what did you tell them? What did you say to them that like all of a sudden everybody's rallying around? But that's just an example of my family and just how blessed we are with family close by that is just so available and so willing and wants to help with the kids. So it's just awesome. It's really cool, and it's humbling, and it always kind of catches me off guard. And it's like, you guys don't feel like you need to do that, because you know we chose to have this many kids this quickly, except for one element of surprise in there, but like we don't want to have to lean on family. And of course, this is the time where we'll need the most help with the babies being newborns, and with me still just kind of recovering from surgery and not recovering well, I wouldn't say at this point. And so this is arguably the time we'll need the most help, but I just don't want to feel like we need it, like we have to have it to survive. And we don't, but it is so nice to have it. So just like an update on me, I've been on the antibiotic for a day and a half. I've had like 1 full day of doses plus, well, I guess 2 full days. So not quite 48 hours of taking an antibiotic, and my skin, like where you could see that there was an infection in my skin, looks better. However, like the pain internally is worse. And so I don't know if it's just like residual inflammation from having an infection going on, and it's to be expected and normal, but it's higher, like it hurts higher up. There's a larger area that hurts, and it hurts worse, just kind of generally worse. I don't have any more flu-like symptoms. Like I haven't had, I take that back, because I feel like last night and the night before both, I was having chills. So maybe I do still have a bit of a fever, but not consistent and not like throughout the day. I called my OB this morning because today was the day that she wanted to make sure the infection on my skin wasn't looking like it was going any further up, and it's not, but the pain is, and it's very internal feeling. I'm more swollen. Like I look, not that this matters, but it's just different. Like I look physically like I did a few days post-op. So I don't know if you can, like my belly, my lower belly is just more swollen and kind of bloated, and it feels inflamed is the only way I can describe it. And maybe it's just normal when you have an infection, but anyway, that's the update on me. So like I said, if there's a day that we kind of do need help, then today's the day, but I don't know.